I think we'll get started, and then I might pause for a moment to let a few other participants in as we get started here. But as I said, welcome to the Spectacular Shoulder Workshop presented by Physio Partners. So we'll get this presentation underway. So what we have is, make sure that everyone can see the screen and what we're sharing here on the PowerPoint. And then we'll go through what we'll cover. So what we'll cover today is how the shoulder complex works, common types of shoulder pain, contributing factors to shoulder dysfunction and pain, some strategies you can try on your own if you're dealing with any shoulder pain, when to seek an expert opinion, and what are the next steps to take for addressing any shoulder pain, again, that you might have. So to give you a little background on the shoulder, and more specifically, shoulder dysfunction or pain pathology. Shoulder pain is the second to third most common source of musculoskeletal pain, which I believe is behind the lower back as number one. But so a fairly common thing to have something go on with it and for it to be painful. Lifetime prevalence of shoulder pain is around 70%. So if you're like myself, you've likely had shoulder pain before. If you're in the majority, and I'm right there with you. I've had some shoulder problems myself. Let's see, we have another fact here of greater than 50% of individuals over 60 have a rotator cuff tear. Which is somewhat misleading only because not all rotator cuff tears are symptomatic. So you may have a rotator cuff tear and not necessarily know it. And sometimes it's intermittently symptomatic so it's not necessarily that greater than 50% of individuals over 60, have a painful rotator cuff tear. And that shoulder replacements are becoming more common. So there's an annual rate of about 30% to 50% higher than hip and knee replacements, which is fairly new. That wasn't the case, a decade ago, where the shoulder replacements were not as common, but they're becoming more common. So we'll talk about the sort of anatomy and physiology function of the shoulder. So which leads us to the question is the shoulder complex? Yes, it is. So there's a lot of moving parts, a lot of muscles, bones, connective tissues that all have to come together, work together to make the shoulder work. So I said, let's take a look at the complex. So oftentimes the collection of these bones, muscles, ligaments are called the shoulder complex. So play on words say the shoulder is the shoulder complex. Yes, it is. So the major parts of the shoulder and the shoulder complex that we'll talk about are the humerus, which is the sort of the arm bone that creates the ball to that ball and socket. You have the scapula, which is this bone on your back or shoulder blade, which creates the socket of that ball and socket. You have your clavicle or collarbone, and then you have your rib cage. And again, all those bones need to work together to create a functioning shoulder. So you can see how it's easy for something to go wrong in that system because there's a lot of moving parts. So what we have with the shoulder complex is this sort of balancing act of what are the two sides of mobility and stability. So the shoulder is the most mobile joint in the body. So you can, move it all the way above your head. You can move it down to your side, behind you, right? So that there's a lot of different movements that the shoulder can do, where the joint structure is similar to your hip in that it's sort of a ball and socket type joint. But the hip is more of a true ball and socket where you really have what is the sort of the ball of the femur sitting in the socket of the pelvis, where with the shoulder, you have more of that ball of the humerus sitting on what is more or less it's kind of, we'll call it it's a golf ball on a tee. And then what happens is the other connective tissues and muscles create the rest of that socket to give you that still functioning ball and socket joint, but it's not nearly as stable as, let's say, the hip. So we have this sort of balancing act going on of having to have the ability to move it all the ways that you can move your shoulder, but wanting to make sure you can stay stable in all those movements as well. So this is an inherent challenge that the shoulder has to deal with, and then we'll discuss further as we talk about the different muscles and bones that contribute to how the shoulder works. So we'll talk about the rhythm, what's called the scapulothoracic rhythm. So this is an important concept when it pertains to shoulder motion generally. So it's different with different movements of the arm. The most easily visualized is going to be what's called shoulder abduction, so reaching the arm sort of out to your side and then up over your head. So in this picture here on the left, you can see that of the 180 degrees of total motion, which is what we expect for a normal, quote unquote, normal shoulder, about 180 degrees of motion. So what we have at this orange arrow here is what is actually contributed to by the ball and socket of the shoulder itself. But that only takes 120 degrees of the 180 degree total motion. The other 60 degrees comes from movement from the shoulder blade. So we call this the scapulothoracic rhythm, in that you have to have contributions from what is the shoulder blade or scapula, the rib cage, the collarbone in the front that you can't see in this picture, as well as the ball and socket. So there's a lot of people that I'll see that will come in, they have 120 degrees of motion, they can reach their arm about here. It's that maybe they get stuck there, or it's painful as they go higher, which a lot of times can be attributed to what the shoulder blade or scapula is not doing, not necessarily what's wrong with the shoulder itself, or again, the kind of ball and socket of the shoulder, although that might be what's painful. So you may not feel pain down here, but this can be what's causing the ball and socket to be stressed more than it should be. So in our picture here, so it loads in. So this is a depiction of how some of the muscles have to work together to create this scapulothoracic rhythm, which shows you the some of the complexities of it. So the red arrows here are different muscles and how they have to function. So you have the deltoid muscle that lifts up on the arm bone to lift the arm up. We have the upper trap, which helps to pull the shoulder blade into what we call an upward rotation. So this motion here on the left, as the lower border of the blade goes up, is what we call upper rotation. So upper trap can help with that upper rotation. We also have the middle trap here pulling in, which helps to keep the system sort of spinning on that fulcrum that we see there. We have the lower trap, which also helps with the upward rotation, and again, kind of pulling this inner edge down. And then this muscle down here, they call the serratus anterior, which pulls the lower border of the shoulder blade forward. Again, sort of creating this this rotation and lifting effect for the shoulder blade to help with the shoulder. As we talked about a little bit earlier, was that this is different with different types of motion. So it more pertains to overhead motion, where we can see in this picture, where you can visualize what happens when your arm's going into what we call shoulder flexion, where the arm's reaching forward and all the way up. It's not so much that we need the shoulder blade to rotate as we do with abduction, as much as we need it to tilt. So what we see is that the lower border of the shoulder blade here should be brought in toward the front as your arm lifts up, so that tilts and allows your arm to go higher. I think this picture really helps to show what can happen when you have a stiff middle back, and how the rib cage and the mobility in your middle back can contribute to shoulder issues. Because what we have to see is that the spine here has to be able to move, has to be able to bend backward or be more upright to allow this lower edge of the blade to come further in. So if it was really rounded through here, it doesn't really allow you much room for the shoulder blade to move. And again, the arm can get stuck before you might reach what would be, that topmost cupboard in the kitchen, or especially if you're doing, let's say, a sport overhead, like serving tennis ball, something like that, where you might run into some issues if the middle back is not mobile. So again, it's a fairly complex system. where then we have to deal with the balances of all these muscles, making sure that anything's not too tight or weak. So I think that's why a lot of times it is helpful to get, let's say, an analysis of what's going on with your shoulder, just so we can figure out what's best to work on, because there's a lot of pieces and moving parts. So we have here is, again, talking about the most common types of shoulder pain. So about 80% of non-operative patients with shoulder pain fell into one of three categories. So first category is joint mobility deficits, which most apparent is adhesive capsulitis or frozen shoulder. But there's other pathologies that fall in this category, really anything that, where again, we talked about that balancing act of mobility and stability. This is where you're almost too stable and rigid, and you've now lost mobility, which creates a problem. Frozen shoulder is a unique entity. We're still learning things about frozen shoulder in terms of what causes it and how best to treat it, although there are standards of care at this point in terms of how to treat that. But again, I'd say things that deal with the shoulder being, let's say, stiff, where the joint doesn't move, is a big part of what a lot of people deal with in terms of shoulder issues. The next one, talk about muscle performance deficits. So again, this is where we talk about that image you saw before with all those muscles helping to create that rotation of the shoulder blade. If we have a sort of a muscle imbalance, then it kind of would fall into this category of muscle performance deficits. What's also under the umbrella of this would be what's called subacromial pain syndrome, and is likely occurring with most shoulder issues, which is basically the irritation of some of the structures that run in this subacromial space, which we see here, the acromion process being the kind of topmost portion of the shoulder blade, which wraps on top of the socket. And there's some tendons that run between those two bones of the kind of the bone of the arm and this acromion process, which can get irritated, inflamed, impinged. So if you've heard of impingement syndrome before, that's what that is. Our last category is motor control issues. So this is where we're talking about more instabilities. So this would be your dislocations, subluxation, which is just a kind of a minor version of a dislocation. And there's a few other specific types of instabilities. But again, so this is when you have that balancing act of stability and mobility. Now you're too far heavily weighted toward being too mobile, which creates a problem if that ball and socket doesn't stay aligned, or if in certain position, certain structures get too stretched because it's so mobile, which can cause pain, or you might see limited motion, things like that. So talk about some risk factors for developing shoulder problems. So we have age and degenerative changes. So being kind of like your arthritis, and certain pathologies just tend to occur in certain age categories. Again, a lot of the more traumatic pathologies happen earlier in life, where someone might be playing a more aggressive sport or have a traumatic fall, things like that. Later on, we start to deal with more with like arthritis and those types of issues. Then we have overuse related to work or recreation. So if you're doing a lot of work with your hands, work with your arms for your job, or if you're an overhead athlete or use your arms a lot in a sport, or with working out, again, that might be contributing to a shoulder issue. Mechanics, poor mechanics. So I make sure form is really good. So bad form can definitely lead to some shoulder issues. Comorbidities, so other medical issues such as diabetes can contribute to shoulder issues. We have genetics. One of the big things with genetics is, as it relates to that, what we call subacromial pain syndrome, is the shape of that bone called the acromion, which is kind of right on the top of the shoulder here. Sometimes it's more hooked, it kind of can hook over to the front of the shoulder a little bit more, which can cause some more friction and irritation. So that's where genetics can come into play. Also with shoulder stability. So if you happen to be genetically hypermobile, that can be an issue that relates to genetics, where you still have some control over that, but you might just be genetically predisposed to being more mobile to previous injury. So any injury that you had in the past might contribute to why you might have pain currently. Overhead activities, again, talked about the sports earlier, but then if you're just doing a lot of work overhead, that could contribute to developing some sort of painful shoulder condition. And then gender, just we see certain trends with different diagnoses based on gender as well. So if you're looking to self-diagnose and work on what would be something you're dealing with in terms of your shoulder, you want to make sure that you're going to the right provider, that you're seeking the right type of medical care. So these would be the signs that you should seek medical care immediately. So again, going into immediate care, emergency room, things like that. So if it's more of a traumatic shoulder injury or pain, so say, for example, if you fell from greater than 3 feet, landed on the shoulder, possibly had a dislocation, arms now out of socket, that would not be something that you should come into our office for. You should go to the emergency room to get the shoulder reset, or identify any fractures. That's the other thing we're screening for with more of these traumatic shoulder pains. So if it's severe pain, swelling, or instability, again, you should seek care immediately. If we see signs of joint infection, such as fever, swelling, redness, and limited motion, so looking for what would be shoulder pain on top of some of these systemic factors, such as fever, and it could be swelling or redness in more places than just your shoulder, or again, the joint could be infected itself. So again, good to get that checked out more quickly. And then any unexplained motor or sensory loss. So if you then find that you can't move your arm or you have lost all sensation in your arm, would be something to seek care immediately for. And then just so everyone knows, well, I'll take some questions at the end. So if you have any right now, feel free to, if you'd like to write in the comments box, or we'll take questions at the end. So here's some of the key players in terms of what we work on in physical therapy, and then what also contributes to both having a healthy and happy shoulder, as well as possibly having a painful shoulder. So we have pectoralis muscle length. So again, pectoralis muscle being in the front across the chest. If that gets tight, this is most often the case, so it gets tight and can pull the shoulder further forward and kind of turn it inward, which can compress some of the structures in the front, also makes it harder for some of the muscles in the back to then work properly. So a lot of things, many times what we work on with someone coming in with a shoulder issue is working on different ways that we can try to lengthen this pec muscle. I don't know that I've seen many people with a too lengthened pec muscle. We're typically trying to lengthen it. We have scapular muscle performance. So again, this is that picture on the top here. Want to make sure all these shoulder blade muscles are working the way they should. They need to they need to be strong. They need to be able to work when they're supposed to work, so the timing of them can make a difference too. So that's a lot of the retraining that we would end up doing. Thoracic spine mobility and posture. So we're talking about this picture here, where, as I was talking about earlier in that slide, which you can see from the side, is you want to make sure that the middle back can bend upward and you can get more upright, so that you're not putting more stress on your shoulder. I think always and a thing that you can do that kind of shows you the importance of posture and thoracic spine mobility is if you're kind of sitting in a chair and you're kind of slumping down, letting your shoulders sink forward, and you try to lift your arm up. I'd say, again, this is if your shoulder's not already painful to go into upper motion, but if you feel like the shoulder, or maybe if one side's painful, try the other side. If you're in that kind of slumped and slouched posture and you're to reach the arm up, it gets stuck fairly quickly. And I would say that's not necessarily the most comfortable thing I've done. And that's on my shoulder. That's not my problem, the shoulder problem side. Then if you sit back, if you sit upright and you try to get really your shoulders back and you reach arm up, it's much easier to go higher. And then many times it's less painful. Next thing we have is capsule length and extensibility. So we call the shoulder capsule all the structures that create that socket around the ball. So we make sure that the capsule is not too tight, again, affecting more of the mobility, or it's not too loose and it's moving around too much. Rotator cuff muscle performance. So rotator cuff muscle, it gets a lot of attention in the shoulder world. A lot of times it gets attention for being the source of pain or the cause for why someone's in PT, or what they found in an MRI with the fraying, tearing, things like that of a rotator cuff. But it's a really important muscle group when your arm is moving. So as its name tells you, it helps to rotate the arm, helps to rotate the shoulder. Its other important function that doesn't get talked about quite as much is it helps to keep the ball centered in the socket. So as you go to reach your arm up or out to the side, it pulls in so that that ball is not moving any direction as it's spinning. So it helps to create this sort of spin of the shoulder, which is, again, really important, especially as you get to those kind of ends of the motion with the shoulder. Acromion shape, we talked about a little bit in that other slide. So we have the shoulder blade here with the acromion on the top here. Again, sometimes the end of this can be a little bit more hooked, which can cause a problem. So there are certain surgeries people undergo where they just kind of shave off that hooked portion of the acromion, which can help. And then the last item here is the kinematics. So again, this is talking about just of how everything works together, and making sure that the shoulder blade can move, the shoulder can move, the middle back can move. The muscles that would attach from kind of the neck to the shoulder aren't too tight and aren't kind of yanking the shoulder up, which is a thing we often work on in PT. So that's all important there. So the next question is, so how do I prevent pain if I don't already have it, or possibly even help to start treating it, or try to make sure that, if I have one side that's painful and the other that's not, to try to make sure that that not painful side doesn't get painful. So first and foremost is proper ergonomics. So you want to make sure you're moving the right way. You want to make sure that when you say, if you're doing any repeated use of the arm, so let's say if that's for work or for sport or recreation, or if you're even just sitting at a computer, sitting at a laptop, sitting at a desktop, on the phone, on a laptop, or on a tablet, excuse me. You want to make sure that your ergonomics are good. What happens there is it's not a ton of stress necessarily. Let's say, so like being on a laptop, it's not that for a short period of time that might be a problem. But as you expand it to be a longer period of time, so if you go a couple hours, 4, 6, 8 hours that you're on the laptop, it's a low amount of strain that's applied to the shoulder for a long period of time, which can cause problems. So that kind of meshes well into our next preventative pillar in posture. So important, we put it 3 times, posture, posture, posture. So hugely important when it comes to the shoulder. That starts to affect the certain muscle lengths. So a lot of times we'll get the pec that gets tight due to poor posture. Then some of the shoulder blade muscles get more stretched and they're not as effective in terms of then their strength. The head position is really important. So again, in poor posture where the head starts to fall further forward, it starts to pull at that shoulder blade more. As the middle back gets more rounded, the shoulder blade can't move how it's supposed to move. So definitely could contribute to shoulder problems. I would say that 99% of people that I see for shoulder related pathologies, posture is a big piece of the puzzle. Scapular strength is then our next pillar. Again, wanting to just do some cross training and making sure that those shoulder blade muscles are really strong. Next one is again, staying strong and flexible. So it's just more of your just general fitness, because again, with posture, core strength comes into play, and just general flexibility kind of across the board is important. So we say just more so generally speaking of getting strong and staying flexible. And the last one is avoiding injury. Injury can, along the course of the lifespan, can definitely rear its head later on. So if you avoid injury in the first place, then it can't come up later. So then you'd say, why might you see a physical therapist and then not just sort of undergo treatment yourself or try to, do things on your own? So this would be why you might see a physical therapist. PT is a nice one-stop shop where we can help you determine what might be causing your shoulder pain. So not only what's painful, but what actually is causing it, which are oftentimes for a shoulder are 2 separate things. So it might be that rotator cuff tendon is inflamed and irritated, and you might feel it in the front of the shoulder here. But again, it might be the shoulder blade that is what's the cause of this tendon getting overworked. Figuring out what might be contributing to your injury, because we're talking about finding that kind of cause or what led to it in the first place, which is always important to help avoid it again. You can't change things that you don't know are a problem. Finding relief. So we have a lot of different things we do for, say, the symptom management strategies, trying to get you some relief from pain or get you some more motion, so it's easier to move around and do things throughout the day. Fix the issue with our next steps. So again, hopefully, best case scenarios, we're able to fix everything and you're able to take it from there, or learn what else to do. Like if PT is not going to be the only thing to help you, we can give you some good guidance as to what to do next. Here's some things you might expect if you were to come to PT for your shoulder. So manual therapy, a lot of different interventions that fall under this category. So this is all of our hands-on work. So this would be kind of some massage work, what's called instrument-assisted soft tissue mobilization. So it's using basically a tool to do work on the muscles. Dry needling, which is this picture on the bottom left here, which again is, if you're not familiar with dry needling, it's another way to loosen up what are tight muscles. We find these what we call trigger points, and then we eliminate trigger points with the use of a needle. So if you haven't heard of it or tried it before, it can be a really effective thing to do for tight muscles. Works really well for the shoulder. I've done it. I'm a certified dry needling therapist myself. We have a couple other dry needling therapists on site as well that you could see and try that out. Joint mobilizations, manipulations. So this is more manipulating the that capsule tissue, so that again, everything that kind of forms around the ball, as well as just making sure that ball and socket can move the way it should. If there's a mobility issue, then we give you some flexibility and stretching exercises. Again, and sometimes we have to be creative with what flexibility and stretching exercises we give you, because there's certain times where we want to stretch one thing, but not necessarily another. So doing the sort of run-of-the-mill YouTube video, fix your own shoulder stretch isn't necessarily the best one for you. So we try to find the perfect stretch for you. Again, same thing with the strengthening. I think with the shoulder in particular, form is really important. And I would say that I haven't seen a single person who's had form completely down and has been able to do it without any corrections whatsoever. So I think that's where we get into the next point, which is the stabilization and muscle recruitment exercises or activities, where it's not so much about doing a certain movement, it's sort of how you do that movement. So we do a lot of retraining on how the shoulder blade should work. Again, how that shoulder blade moves with the arm moving up. Again, everything has to work together. But again, it's something that takes a lot of practice. I think I can tell you personally, I've worked on that for 10 years now. I feel like I'm getting a better grasp of it, but I still have to work on it. So it's a ongoing process, but it gets easier as you get to some of the fundamentals down. And then education. So in terms of what to do, what not to do, what should be the next steps, that's always useful information as well. What you might try for home, equipment you might get, which I'll give you some suggestions later on. So some next steps. Again, if you have any issues with your shoulder, you can absolutely schedule your complimentary physical therapy consultation to discuss symptoms, and we can try to help figure out what your next step should be. You should try to control your modifiable risk factors, initiate a cross-training routine, again, which is a lot of the kind of shoulder blade exercises. But again, I think that may not be enough, in that you might have to learn how to use your shoulder blades correctly in those shoulder blade exercises. But a cross-training routine is definitely a helpful thing to do. You can also try out this program that we put together for you, which again is going to be some general things you can do for a shoulder. So it can be accessed via this URL here, which I can send to anybody. And I'll pull this up so we can take a quick look at it. Again, very general program. I'd say if anything bothers, if your shoulder is painful and you're doing these and the shoulder is painful, don't keep doing it. But this would be something you could try as a sort of a first step. Which actually, let me pull up here real quick. second to get this code over here, which is a software called Medbridge. If you're a patient of ours, you'll be familiar with this software. If you are not, it's a software that allows you to see your home program. Just make sure that alrighty. So we have the program pulled up here. So we have is a pec stretch to start, which is going to use a door frame. It tells you on the right of how many times to do it, how long to hold it, etc. We have the bending backward over a chair. It's a nice pec stretch and middle back stretch. Again, tells you how many times what to do there. We call that seated cervical retractions, or we call it chin tucks. Some we call punches for this serratus anterior muscle, which is notoriously challenging to isolate when you're strengthening. A rotator cuff exercise that we have here, which I started this program is it gives you videos of these exercises. So it'll, you press the play button there, it'll take you through the setup, what to do, how many times to do it, and give you the video of it. And we have a neck bending stretch. What's also on here under the program notes at the top is links for some of the equipment that I'll talk about next. So that's all there for you, which you can access. Let's get back to our PowerPoint here. Right, back to the PowerPoint. So here's some useful tools you might try if you haven't used them already. So we have the what are postural straps. So a couple different options here of ones that we've worked with in the past. One's called a straighten up strap, which is the one on the left here. And then this is another postural strap, which is slightly different in that it has this, we'll call like lead in the middle of the back. So it helps to maintain that more upright back posture. Again, both are available via Amazon, but are useful to help remind you, especially when you're sitting or on a computer for a long time, helps to remind you to maintain good posture. Again, it's intended to be used for about 20-30 minutes at a time. It's not necessarily something you wear all day long, and it's not a vice grip to hold you back and squeeze the shoulders back together. It's just a gentle reminder. So you put it on when your posture is good. So when the shoulders start to fall further forward, there's a little tension pulling back, and it reminds you to reset those shoulders back. Next device here is a foam roller. Very useful tool. You can use it for upper body, lower body, back, pretty much everything. It's definitely one of my favorite mobility tools. Again, there's the link in that Medbridge program for you for this one. And then we have the elastic resistance bands, which are simple, straightforward, but are really, really helpful for shoulders. Like that quality of resistance, the fact that it's very modifiable, you can go really light and you can go really heavy if you want, is really useful for helping a shoulder. This is our plug for the PhysioPartners virtual wellness classes. So again, if you're talking about this sort of like getting strong and staying flexible concept and a cross-training routine, this is absolutely a way that you could do that. So we offer circuit workouts, mat Pilates, and then a group Schroth class for scoliosis, which would be only for if you have scoliosis and have seen one of our Schroth therapists before. But if you go onto our website, physiopartners.com, and you go up to the wellness tab, the first one there is called virtual wellness classes, which allows you to book and schedule wellness classes, which we run multiple days per week, which again is a nice way that you can cover your bases in terms of getting some shoulder blade workouts and getting some lower body workouts, become more sort of in tune of how the shoulder blades and how the body's working. So I think we'll open it to any questions if you have it. Yes, I think I have one question here in the chat, just saying that if I can, I'll link in the chat that link that we were to the Medbridge and the code, which actually let me do that right now. And then after that, we'll. That's our code. send out just the link for the Medbridge and then the code here so that you can access it yourself, which also has the links for the equipment that we're recommending there. Let's see. And then I'm happy to take any other questions that anybody might have, which feel free to write that in the chat. Otherwise, feel free to unmute to allow that. Of course, thanks, Deb. I'll stick around here for a few minutes in case anybody else has any questions. But yeah, thanks for everyone for joining. If you have any other questions, I'll also write in here my my direct email. So if you have any questions for me or would like to schedule the consultation, let me know. We can get that on the books. So just put in my email there in case you have any questions or would like me to explain anything a little bit further. I'm happy to do so. I think what I was forgetting. So that was my slides are a little bit later. I have a last slide here, which has some exciting news too, which is so as we talk about our last slide, just telling you where we are located at. So we have a location in the Loop. We have a location in Lakeview, and then we have a new location coming soon in Glenview, which we actually hope to have be operational in October. So it's coming up shortly, which will have more announcements coming soon once we have everything completely finalized. But just so everyone knows, we'll have a new clinic coming soon in Glenview, which will be near the Glen. If you're familiar with the Glenview area, it'll be near the Glen. And we'd be very excited if you have any friends or family members who are in the area and are in need of therapy, or you yourself are in that area. We'd be happy to see you there. Okay, thanks everybody. Take care, and I hope to see everyone around. Bye.
Thanks, Joe.
Thanks.